I'm Mackenzie O'Keefe in the CBSN Denver studio. November is Lung Cancer Awareness Month, and lung cancer is the third most common cancer in the United States, and it's also the deadliest. That's why prevention and early detection is so important. So joining me now is Dr. Jenifer Marks, a surgeon with the Medical Center of Aurora. And Dr. Marks, what are some of the signs and symptoms of lung cancer that we all should be aware of?
Well, once lung cancer gets to a more advanced stages, patients can experience symptoms such as cough, shortness of breath, or even spitting up little bits of blood with their mucus. As you mentioned just a second ago, the key thing is actually finding it before it gets to that point when it is asymptomatic. And that is why Lung Cancer Awareness Month in November is so important, and all of our local screening programs are pushing to get patients in to be screened.
Great. And we know smoking is obviously a huge risk factor for lung cancer, but what are some of the other risk factors that people might not know about?
You're correct. Smoking is really the only known significant risk factor, and 85% of lung cancers will happen in smokers. Here in Colorado, another known risk factor is also the amount of radon that can be found in our environment. And so many patients will have their homes tested for radon levels and have mitigation systems installed if their levels are elevated. But those are really the only clear two risk factors that we are aware of. A family history does increase your risk somewhat, but if you are a never smoker, it still is not an exceedingly risk with just having a family history.
Great. So tell us a little bit about those screenings you just mentioned and why they're so important and what people should know about them.
Yes, so patients who are high risk are eligible to have a low-dose CAT scan as a screening mechanism. The amount of radiation is very low. It is a low-dose CAT scan. And the people who qualify are people aged 55 to 74 with a significant smoking history and without any symptoms. And anyone can simply ask their physician if they think that they would qualify for a CT scan. It's not an invasive study. It takes just a few minutes, and it has been shown to reduce the risk of mortality from lung cancer by about 20% if we can get those patients in and be screened.
Wow, and we know there's been a lot of changes in lung cancer treatment over the years. What kind of advancements have you seen in that?
Well, the main thing that has happened most recently is advances in immunotherapy or different types of chemotherapy that are available for patients with more advanced disease. And then interestingly, those patients with more early stage disease were now able to, diagnose smaller and smaller nodules with some of our advanced bronchoscopic techniques, and then also perform their surgeries minimally invasively. So small incisions, quicker recovery, shorter time in the hospital. So all in all, we have come a long way, and it's all about finding those nodules early when we can hope to treat the patient for cure.
Great. And we've seen, according to the CDC, Colorado has one of the lowest rates of lung cancer in the country. Why do you think that is?
Because we live in the mountains and everyone's out there exercising instead of staying at home smoking. We have very low smoking rates, so we do have, given our population, a lower incidence of lung cancer than many other states with higher rates of smoking.
That's great. Yeah, a lot of people love to get outdoors and do the outdoor adventures, so that's great too. Is there anything we've missed that you want people to be aware of?
I would just say, there is a stigma associated with lung cancer because of its relation to smoking, but let's get over that. Let's move on. If anyone knows a smoker in your family, encourage them to go out and get screened. It often is that, friend or family member that finally makes the final decision in having someone decide to go get screened. So just be supportive, be encouraging, and there's nothing scary at all about going for a CAT scan.
Great. Thank you so much, Dr. Marks, for all of that very important information. We'll be right back.